Eventually, you may get to the point where you want to consider surgery. So once you've exhausted non-operative treatments, surgery is the final option to take care of your hip arthritis. Now, this decision is important and it's a big one, and it's solely up to you. It's not your family's decision, it's not my decision, it's yours. I can certainly help you with that and help you get prepared for the surgery, but ultimately the decision rests with you. Once you decide to have surgery, we'll do everything we can to optimize you, meaning have you in the best possible condition to undergo surgery. You go to a class to learn about hip replacements. We'll do laboratory tests to make sure you're in good shape, and we will give you all the resources you need to prepare for the upcoming surgery. Usually surgery is scheduled about 4 to 6 weeks out, so we have time to get you ready for the procedure. Most procedures these days are being done as an outpatient, meaning you'll come in, have surgery either at Lynchburg General Hospital or at the Surgery Center of Lynchburg. You'll have surgery in the morning or afternoon, and you'll go home a couple of hours later. In certain situations, if you have more medical conditions where you don't have adequate resources at home, you may spend a night in a hospital. But we've found that patients are very happy with excellent results when they go home the same day. Your surgery will either be done with general anesthesia or with a spinal anesthetic. That will be based on your preference, your medical history, and your discussion with an anesthesiologist. The surgery will take about an hour and a half, and then you'll be in the recovery room. A couple of hours later, you'll be up walking and should be able to be discharged later that day. As with any surgery, there will be pain, but hip replacements are usually managed quite well with a combination of therapies, which we call multimodal anesthesia, which reduces the amount of narcotics that you'll require. So we can use nerve blocks, ice, an injection of a local anesthetic, pain medicine, NSAIDs, and Tylenol to help control your pain. This is a model of a total hip replacement. So when we do a hip replacement, we remove the ball that's of the femoral head. The acetabulum of the cup is reamed. It's smoothed out with a hemispherical reamer, and then a metal shell is inserted. That gets wedged into the bone, and there can be a screw or two that can assist that if necessary. Into that, a piece of polyethylene is able to click into that metal shell. On the femoral side, we use reamers to open up the canal where the soft bone is, where the bone marrow is, and we enlarge that canal until this stem can wedge into it. The stem has porous coating onto it so that bone will grow into it. So when we insert this, it gets wedged and is very stable. Onto that, we're able to attach the femoral head, which comes in different diameters based on the size of your bone and how long we need to make the length of your femur. This is made out of ceramic, so when it all comes together, the ceramic head clicks in and rubs against the plastic liner of the acetabulum, so it's perfectly smooth and will increase your range of motion and will eliminate the pain that precipitated or caused the need for the operation. This image now shows the hip replaced. So there's the metal cup in the acetabulum, which is wedged into the bone, the piece of plastic which cannot be seen, which clicks into the metal, and then the stem, which is reamed into the femur, and then the ball which clicks on top of the femur. So we have a nice smooth ball articulating with the plastic liner. Immediately after surgery, you'll be on a walker, and you'll be on that walker for a week or two. After that, you'll transition to a cane, which you'll be on for 4 to 6 weeks. You will not have to go to physical therapy. Most patients are able to rehab at home with a home exercise program that will progress week by week. In the past, patients often went to skilled nursing facilities for a week or more, but we found that patients actually do better with less risk of complications, less risk of infections and readmissions to the hospital. Therefore, unless absolutely necessary, our preference is for you to be able to go home after your surgery. Hip replacement surgery is an extremely successful surgery, but there are risks that you need to be aware of. One of the risks is an infection.
So whenever we do surgery, there's a risk of infection with bacteria getting into the wound or in and around the prosthesis. When that happens, it can be a devastating complication, so we do everything we can to minimize it. Our infection rate's very low, but if it happens, it often requires 2 or more surgeries to get rid of the infection. So we'll give you antibiotics before and after the surgery to try to decrease the risk of that happening. Another serious complication is a blood clot or DVT, which can form in your legs during any surgery, but particularly after hip replacement surgery. We'll give you medications such as aspirin or stronger anticoagulant medications to try to decrease the risk of this happening. It doesn't happen often, but when it does, it can have dire consequences. Occasionally, the blood clot can dislodge and go to your lungs, which is called a pulmonary embolism, which can be fatal. So we have to be very careful to try to decrease the risk of that happening. Another complication that can happen with hip replacements is a dislocation. So if you get in a bad position, the hip can pop out. It's very painful and requires anesthesia to put the hip back into place. So we'll show you the positions to avoid and exercises to do to strengthen the hip and decrease the likelihood of a dislocation happening. Other issues patients sometimes have can be nerve issues, where the nerves that go down the leg can be affected, where you can have some numbness, sometimes weakness in the foot. In some circumstances, the hip that we operate on could be slightly longer than the other side, so you'll feel that initially after the surgery. For many patients, they've worn the hip down over time so that the hip that's affected is a little bit shorter, but that's happened over years. Then during a surgery over an hour and a half or so, we increase that length back to where it should be, sometimes a little bit longer than where it should be, to make sure the hip is stable. So when you get out of the operating room and stand up for the first time, the leg may feel longer. Oftentimes we have to make it a little bit longer to make sure that the hip is stable and does not dislocate. In most situations, after a month or two of walking on it, the muscles get accommodated to the new length and the discrepancy is no longer noticeable to you. We don't know exactly how long a hip replacement will last, but hip replacements that were done years ago lasted for 15 years. Over 90% were still in 15 years later. The materials we're using now are so much better, with ceramic balls and improved polyethylene on the plastic cup, that the hips are showing much better wear rates. And we're hoping as time goes on that hips that used to last for 15 years will last much longer than that.
Overall, a total hip replacement is an excellent operation with a long track record of improving function and reducing pain. I hope this video was helpful. If you have any questions, please contact me at the office.